Psychoanalysis, mechanisms in personality disorders and component instincts. Namaste. Ever since Freud conceptualized component instincts, it has led to a fervent stir on the point of tabula rasa and inherited elements of the mind. Some of the mechanisms underlying personality disorders seem to be exaggeration of some of the component instincts. Our discussion today has this for its focus with psychoanalysis consultant Dr. Himanshu Vaidya. Namaste, sir.
Namaste.
Sir, let's start with Freud's concept of component instincts. What does it roll out?
If we look at Freud's conceptualization, he talks about certain inherited parts of the psyche, of the system. And he conceptualizes two fundamental drives, the life drive, eros, and the death drive, thanatos. And the life drive expresses itself or effectuates itself in the form of drive for survival, for pleasure, and for expansion of the ego. For all that we say is constructive, positive, reasonable. And that drive effectuates itself, expresses itself in the form of dealing with and often liking pain, destruction, death. And both of them interact with each other, at times express themselves in a solo state. And the expression happens through many ways, but largely through what Freud calls the erotogenic zones. And this expression through the erotogenic zones happens in a sequential, phased, predictable way through the phenomena of what Freud calls psychosexual development. Now, Freud conceptualizes, apart from the life drive and death drive, apart from the psychosexual stages of development, apart from primary and secondary narcissism, he also conceptualizes that there exist right from birth 4 distinct entities that he calls as component instincts. And these component instincts, as the word suggests, have 2 characteristics to them. One, they are instinctual, so they are inborn. And 2, they are components, meaning later in life, they have to become part of a larger assembly, a larger mechanism of which they will be components. So they are cogs to be in the wheel. When the wheel gets manufactured, the cogs will go and become parts of that wheel. So these component instincts are components of a later instinct, the genital instinct. So towards the end of the psychosexual development, under the genital organization, where the reproductive sexuality becomes that overarching mechanism, this component instinct go and attach themselves to that mechanism, become a cog of that wheel, and become constituent parts under the overall hierarchy, overall anchoring, overall power and purpose of the genital reproductive mechanism. So they have to be subservient to the overall reproductive sexual mechanism at puberty. However, what happens if this does not happen? And that is where the inevitability of the component instincts successfully becoming a part of the larger genital constellation at puberty, at the genital stage, which Freud says is the last stage of psychosexual development. So he talks about the oral stage, the anal stage, the phallic stage, or the Oedipal stage, and then there's a latency period. And at the end of the latency period at puberty, we have the genital phase, where the adult sexuality makes an appearance, and the constellation of adult sexuality consumes, or rather, the component instincts become parts of the larger constellation of the adult genital sexual reproductive mechanism.
Right.
So Freud conceptualizes this as to be the trajectory of the component instincts. Now, what are these component instincts as he lists out? The component instincts he lists out are 4, which are very popular. Scopophilia, the desire to derive pleasure by seeing. To see something, the desire to see something and derive pleasure from there. Exhibitionism, the desire to show off oneself and derive pleasure from there. Sadism, the drive to derive pleasure by inflicting pain or domination on somebody else. Masochism, the pleasure obtained by humiliation of the self or giving pain to the self. Getting dominated. So these 4, according to Freud, are component instincts inborn, and they make their appearance in across life, and in the early psychosexual stages, we see them in different ways. We see the oral rage of the child trying to bite off, where the sadism comes out. We see the exhibitionism of the child, how happy he is to show himself off. We see the scopophilia of the child, how eager he is to see what is there in the box, what is there in the next room, what is there in the cupboard, what somebody else is doing, what is there outside the window. So we see those elements there in the child across all the psychosexual stages and across life. Now, the important point is, if we look at the 4 component instincts, and if we also look at the life and the death drive theory, something interesting comes up. It appears as though scopophilia and exhibitionism pertain more to the life drive, eros, and sadism and masochism pertain more to the death instinct, the thanatos. There is also a kind of sequentiality to their strong appearance in action. It appears as though in most situations, the life drives, the 2 component instincts, which are the life drive component instincts, so to say, they make an appearance earlier, whereas the 2 component instincts, which are more of death drive manifestations, so to say, they make, chronologically speaking, a later appearance. Now, in a healthy individual, all the 4 component instincts would be in due proportion, making an appearance in a healthy way, and as the healthy developmental process suggests, become parts of a larger genital mechanism at puberty. This would be if everything goes healthy and happy. Unfortunately, in many cases, I would say in most cases, it does not happen. And therefore, the component instincts either make their appearance in a disproportionate intensity before the genital organization takes place, or somehow they are not able to be subservient to and become a successful component of that larger adult sexual genital mechanism. And when that does not happen, then the component instincts, instead of becoming subservient to the larger reproductive goal, they become stand-alone entities which seek their satisfaction divorced from the reproductive process. And that is where the difficulty starts, because the component instincts seek their satisfaction on a stand-alone basis on a disproportionate scale. And that is where the difficulties arise, and the pathological phenomena with which we are concerned, they appear because the component instincts cannot be integrated successfully under the overall genital organization at puberty. And then when these component instincts seek their standalone satisfaction or disproportionate satisfaction, then pathology starts. So this is how we can start the discussion of what the component instincts are and how it rolls out. Before we stop this point, complete this point, let me just make a reference to is there something which is a healthy equivalent into which these component instincts can be sublimated? Like when we say envy and we ask a question in the Kleinian frame, that why should envy survive the process of natural selection in evolution?
Right.
That we see envy is such a strong element in human nature. Now, if we from evolutionary psychology standpoint put a question that why should it survive and what significance it has for the species, we get an answer that envy has to sublimate into two things. One is gratitude. Instead of having envy to goodness outside of us, we have gratitude that we have been fortunate enough to see goodness in our life. And second, goodness outside of us inspires us to inculcate, to develop the same goodness inside of us. So envy has this healthy equivalence that it can be sublimated to these things, or maybe the goal is to sublimate envy or transform envy into these things. You can put a similar question on component instincts. And what we get is scopophilia can be sublimated into a search for knowledge. If not sublimated in a pathological form, it will be voyeurism.
Yeah.
Exhibitionism can become a pathology. Exhibitionism is sublimated successfully, can become healthy expression. Sadism may be necessary in the struggle for existence. So if sublimated, it becomes a healthy safety mechanism, a healthy survival mechanism. If not sublimated, it can become a brutal pathology. Masochism can become a brutal self-harming activity if not sublimated. But if sublimated, it becomes a healthy pleasure denial for a larger purpose. And without enlightened masochism, there's nothing great we can achieve in life. Because to develop any capacity of ours, we have to put aside the pursuit of pleasure and take on the painful process of self-development. Whether it is academics, profession, therapy, or anything. So all the four component instincts have their equivalents in terms of the sublimated goals. And they also have the pathological endpoints if not sublimated. So this is can be an entry into the discussion on component instincts, and we can take off from here into other areas of the subject.
So you mentioned that if there is a lack of integration, it can lead to pathology. So what can prevent integration of these component instincts under an overall genital organization?
Very good question and a very difficult question. The first can be constitution. Either this component itself, either the component instincts are too strong to yield to integration, or the integrative mechanism is just not there. Now, this is a metaphorical explanation. In real structural and functional terms, what elementals are at work, we don't know as yet. But what we know is this, that either it is too strong to be integrated, or what integrates that mechanism is too weak. So the first component is constitutional. The second component has to do with the developmental process. And the developmental process...
I just need to take a pause. I'm so sorry. There is some...
So first we said was constitution. Second, difficulties on the developmental path. Now that can be divided into two parts. One is difficulty in the Oedipal stage and difficulty in the pre-Oedipal stage. Difficulty in the pre-Oedipal stage can be very early life object loss, very early life object attack, inadequate love, inadequate warmth and responsiveness from the present object, what we call the cold refrigerator mother. So refrigerated environment around oneself. For some reason, the split remaining open. It can also be because of envy. The naturalization, the neutralization of the death drive with life drive, or to put it more specifically, aggression with love not happening adequately. And instead of that coupling in the decoupled state, pure aggression remains in the solo state. The inadequate mirroring of the caregivers. The 5 A's that we talked about. The attention, acknowledgement, attention, acceptance, affection, admiration. So all these factors are pre-Oedipal factors. So these pre-Oedipal factors can predispose you towards not having a resolution at the Oedipal stage. So when you enter the Oedipal stage, you are already entering with a trauma. So the chances of going through successfully in the Oedipal stage are very low. Second situation can be that there may not be a pre-Oedipal difficulty, but the difficulty is primarily at the Oedipus. The Oedipus is the center of this. A successful Oedipal resolution is very critical for the component instincts to later on join into the overall genital organization. So Oedipus is the critical thing, and the pre-Oedipal pathology, either by making Oedipus resolution difficult or on a standalone basis by themselves, can also lead to the same difficulty where the component instincts either become too strong or they refuse to become subservient and parts of the larger genital organization at puberty. So if that happens, what we see as an outcome is so what happens when the Oedipal failure happens? There is a terror of castration, unbearable guilt, unbearable pain of loss, unbearable defeat, unbearable anxiety, humiliation, disappointment, resignation. Entire basket of feelings emerge in a very intense way. This is a very important element, because if the Oedipus is not resolved successfully, either because of Oedipal issue or because of a pre-Oedipal issue leading to an Oedipal issue, or standalone pre-Oedipal issue, whatever be the cause of it, it's very difficult for component instincts then to undergo a healthy assimilation. And then what happens is, they demand a satisfaction separate from the reproductive sexual satisfaction. So then we get into situations of pathology like exhibitionism, pathological exhibitionism, pathological voyeurism, pathological sadism, pathological masochism, and the worst happens when they get such a force that not only they impair the normal reproductive sexual process, but they stand as competitors to that process. So this is where the more difficult path of the pathology makes an appearance.
Right. So what happens if the component instincts remain as component instincts and don't get integrated under a genital organization?
So let us take,
as you mentioned, of certain pathologies, can it just remain non-pathological also?
Very unlikely, because take two situations. One, there is partial integration, and two, there is negligible integration. Two pathological situations.
Right.
If there is a partial integration, then the regular act of sexuality becomes strongly flavored with component instincts. Like the person would have, like when we say it becomes an overall part of the reproductive process, meaning the normal sexual process itself has elements of all the four.
True.
What we call healthy sexuality, healthy sexual act, has the components of all the four in reasonable proportion. That proportion can get skewed to becoming a very strong, slightly discomforting, unsettling proportion. It's outside of the normal zone. So it gets strongly flavored by either one or many of the component instincts if there is partial integration. Whichever component instinct is partially integrated, that makes an out of proportion appearance. The second component, second possibility happens where the integration is negligible. Then what happens is the component instincts demand a standalone satisfaction, and they try to become a substitute of the natural process. So then a person may get into sadomasochistic acts, but not the sexual act at all. So he is not having sadistic sexuality. He is having only sadism and no sexuality. The component instincts become substitutes of the regular normal sexual act. So instead of becoming a part of that process, they become a substitutes of that process. So in the extreme, then the person gets satisfaction, sexual satisfaction, only by a non-reproductive process, which might be only sadism, only masochism, only exhibitionism, only voyeurism, only scopophilia. So this is the extreme, where the component instincts become the substitutes of what they were supposed to serve. The second is, in terms of the pathology, what we see is pathological exhibitionism, pathological voyeurism, pathological sadomasochism. We see fetishes coming up, where some component instinct generates a fetish. Certain forms of fetishes will come up, and we see conduct disorders because it can lead to bizarre behavior.
True.
And it can also become important components of personality disorders. That these unintegrated component instincts are strongly at work in a person with a personality disorder. And we see in most personality disorders, the integration of the component instincts is generally only partial or very less. There will be very few people with a personality disorder with a healthy integration of component instincts.
So what governs these integration processes? Is it just mere gratification, the need of gratification, or superego is involved, or some defenses are involved for sublimation, integration, or non-integration as well? What governs it?
Exactly, we don't know. But what we know is this, that non-resolution of the psychosexual stages of development or very early life object loss or attack or inadequate mirroring, they somehow set the stage. Constitutionally, we don't know what factors actually are involved in that integration process. So we only have a heuristic understanding, a rule of thumb understanding. We really don't have an accurate understanding of the real integration process.
So in general, we can just think on the lines of non-resolution of the various psychosexual stages can be one of the reasons
when we cannot
for the
explain
magnified.
So when we cannot explain anything, we substitute one unknown by the other and call it constitution.
Fair enough. So as you were mentioning, it brings us to the area of personality disorders and component instincts. What do we see there happening?
Take a few examples. If you take histrionic personality disorder, we see the component instinct of exhibitionism disproportionately asserting itself. If you take certain forms of narcissism, and if you take a Cohesian framework, again, exhibitionism exerts itself at the roots. If you look at the list of personality disorders, you will find sadomasochistic personality disorder. So that literally is the name of the disorder. Two component instincts are found in the name of the disorder itself. Sadomasochistic personality disorder.
Right.
Obviously, it means they have not been integrated, they have not been tempered by the life drive. So we see this in most personality disorders, that some or the other component instinct is disproportionately asserting itself. And one of the things which comes up is we have discussed this before, that the list of personality disorders needs to expand. And more mixed personality disorders have to be accepted. For example, we had a few years before, I think in some past version of DSM, I don't recollect it's 3 or 4 or 2, some version of DSM, there was a disorder called negativistic personality disorder. the person who always thinks and speaks negatively. That has been removed. But I think it should be brought back. Because you do see people of that type.
The pessimist narcissist, I usually say.
Correct. And mostly the anal pessimist narcissist.
Yes. Yes.
So, just as the list of personality disorders needs to expand, probably the list of component instincts also needs to expand. That maybe we are born with a few more component instincts than the 4 that Freud talks about. So, one part. Second part is, in many of the twisted pleasures, we have discussed this in one of our discussions, twisted pleasures. It's titled Twisted Pleasures. So many of the twisted pleasures, you see the appearance of sadomasochistic tendencies, scopophilic and exhibitionist tendencies. So when the component instincts are not integrated, these are the pathological manifestations in personality disorders, in psychosis, in fetishes, and in twisted pleasures.
You just mentioned about psychosis. So does it appear in psychosis in form of the creative delusions and hallucinations, or beyond that?
It appears in delusions. For example, you can find a delusion of somebody loaded with sadism, loaded with masochism, loaded with exhibitionism or scopophilia. You can look at bizarre behavior. You can look at the content of delusions. You can look at the content of hallucinations. You can also look at bizarre acting out. Like bizarre harming somebody or bizarre harming oneself. Or you can look at the entire range of bizarre behavior. So you will see component instinct disproportionately exerting themselves, expressing themselves, effectuating themselves in a range of psychotic behavior, both in terms of their beliefs, their feelings, and also in terms of their acting out. You can see it in violence, acts of violence on the other, acts of self-harm, violence on oneself. So in this entire range of psychotic phenomena, we can see component instincts at work, disproportionately effectuating themselves.
Right. Does the concept need a relook?
Yes, I believe we need more component instincts, just as we need more personality disorders recognized. One way of looking at it is to look at the model of the mind of Tantra, which is at the root is the chakra model.
Okay.
So every chakra would have something which is inborn, maybe more than one things. And one of these things can be a component instinct. So if we look at from that point of view, scopophilia would be related to Agnya chakra. Exhibitionism would be related to the throat chakra.
Because of the expression?
Yeah. Healthy
the need to
equivalent would be,
express?
yeah, healthy equivalent would be expression. The sadomasochistic drives would belong to the root chakra. And because we say that most of these drives, they provide sexual pleasure in a different way at the early stage. So let us say the sexual chakra is Swadhisthana also is involved. And yet that leaves out a few other chakras. You can say in a way that they are not left out. For example, you can postulate to say that sadomasochism also involves a power dynamic. And therefore, in sadomasochism, both the root chakra, the Muladhara, and the Manipur both are involved. And because sexual pleasure is derived, swadhisthana is also involved. But we still see that many of the chakras and many of the petals of the chakras, if you go into the details of the working of each chakra, they are left out. And therefore, there is scope for more component instincts to be conceptualized.
Can survival be one?
Yeah.
Can survival be one of the components beyond life instinct and death instinct? There is in-between mechanism called survival. Can that be one of the components?
The Freudian logic, Freud's logic will be, it is an instinct but not a component instinct because it's not going and attaching itself to a mechanism as a component.
Okay.
So there are two qualifying factors. One, it has to be instinctual, and two, its nature should be such that when the genital organization takes place, it should go and attach itself as a component.
Okay.
Now, many instinctual elements don't go and take part in that process of attaching to the genital mechanism as a component. So they are instincts, no doubt, inborn, but they are not those components which go to that assembly.